So as you do research on deep plane facelift, you'll hear about releasing the face and ligaments and what are they, right? And they're not quite ligaments, right? When we talk about orthopedics, we talk about ligaments holding things together. They're very strong, but these are kind of like condensations of thick tissue that are holding the skin down to the SMAS and from the SMAS to the deeper structures of the face. We have them marked here in X's on this beautiful face, showing where the SMAS muscle, which is shown here, is attached to the deep structures of the face. These X's along here are attachments along the zygomaticus major muscle. Very important muscle. If you don't release those, it'll look good initially when you pull, but that muscle is going to pull you all the way right back down. So those are the ones we have to release off the zygomaticus major muscle. These three here are on the anterior surface of something called the masseter muscle. There are strong attachments there too. So unless you release those, everything's going to fall back down to the jowl. So we've released that. These are the prejowl ligaments, okay? They're areas that are holding the jaw in the prejowl area down. If you don't release those, you're never going to get full movement of that jowl back up to define that jaw. These ones here, a lot of people think are about releasing off the sternocleidomastoid muscle, which is here. But really, these are ligaments that are attached to the parotid gland underneath. And again, strong structure. If you don't release that, no matter how you lift with a sub-SMAS, that gland is going to pull it right back down. There are some deep plane facelift surgeons even that don't release the parotid gland or don't release the zygomaticus fully. So it's important to not just fall for a name, right? There's judgment, there's extent of what we do in our deep plane facelift to really get full release. And even getting 10% more release leads to a much greater, more consistent, more beautiful result.